This is Duke University.
I talked about going overseas and helping people and being in the Peace Corps with friends for a long time, but I was chicken. I was yellow. I was scared. So I stayed in the United States. And then finally someone called us, friends of ours that knew an opportunity through the Church of Christ. Some money was available. And so they called us and said, would you like to go? And so it was just an opportunity that we had that I had to decide either I was going to continue in private practice or do something else. And that adventure took me to the Ivory Coast because there was money for a clinic there. So it was more of an adventure and opportunity, I guess, that we took. It worked out. You see the results of it. So I hope that you have those kind of adventures in your life in one way or the other. In some of those places, we call it a concentrated epidemic because it's in certain target groups, okay, the ones we just described. In Africa, we deal with a more generalized epidemic, okay? And so your prevention methods may change depending on whether you have a very targeted HIV/AIDS epidemic or very generalized. In Africa where we work, it's a generalized epidemic. Everyone's at risk. Everyone knows someone. Everyone knows someone with HIV or sick to HIV. In the United States, you have a targeted epidemic. Probably all of us don't know someone with HIV. If I was talking in South Africa now, we'd all know someone. Okay, so your prevention interventions depend on whether it's targeted or whether it's generalized, and so do some of your support activities. They may vary depending on the type of epidemic you're dealing with. One of the challenges with the AIDS epidemic is that initially we were involved in prevention. And then as it evolved, we got more involved in care and support, and now we're more involved in antiretroviral therapy for a number of reasons, okay? Some political, some socioeconomic, whatever. But what's happened is, now the epidemic is still roaring out of control. And so though we've made some progress in treatment, prevention remains you have to turn off the faucet, you have to turn on the water to make a significant impact. And so like I described, Southern Africa, the epidemic is still raging. So we could put everybody on antiretrovirals, but the epidemic is raging. And so what we have to learn how to do is an integrated, comprehensive community approach, where we can put all these pieces together. So we can even measure that. We could take the Durham area, and I could measure how your prevention's going, how your treatment's going, how your home-based care is going, how your orphan problems and orphanage going right here. So you can do a community assessment of a given community across the board, and then go back and design your intervention depending on the needs of that given community. You may have some prevention but limited care and support, or a lot of home-based care but limited prevention among youth. And I think what we've realized is that you need to have a comprehensive, integrated approach where you're continuing to do prevention while you're providing care and support. Yeah, she was asking about stigma, which is a real problem. Suppose I come to your house today, and I have a white coat on, I have a card that says something medical on, I'm coming to your house. What are your neighbors going to think? They're going to think something's going on in that house. They go, oh, look out, what's the guy doing over there? If I have an HIV/AIDS program, T-shirt, what are they going to think? They're going to think you have HIV, okay? So stigma keeps us providing care and support and home-based care and things we'd like to do. So how do we decrease that? Well, if we have support activities, if we're counseling people, developing self-esteem, income generating, helping people be self-reliant, people begin talking about AIDS, people begin talking about their condition, our clients would frequently go to another community to talk. But when they talk in their community, but we send them out talking about AIDS in different situations, sometimes small, sometimes larger. Then we bring them closer to home. They begin talking in their own communities. And it's very important. I don't know if it happens at Duke here. It's very important people stand up and say, I'm Joe, I'm HIV positive. One of the issues, and I talked to some of the students, I don't know if they're here earlier, about is sustainability. How do we sustain these programs? Okay? And part of it is partnership. So we need to have partnerships with government. We need to have partnerships with the private sector. We need to have partnerships with civil society, with the schools, the faith-based communities. We need to have partnerships, and that's what our people do probably better than anything. In Soweto, is an area of 3.5 million people. We have 260 community partners. 260. Imagine having an association here in Durham with 260 partners. We can change the world. What we talk about when I go to communities that are made up of shacks in Africa is I talk to the community, and the first thing is everyone can do something. Okay? So the question is, what can a student do? Well, you gather a bunch of students together and raise a bunch of money. Okay? We know how much money students have. I have three kids. But students can raise awareness, students can raise money. There are some programs in the U.S., very large now, started by students, okay, to raise awareness and interest in HIV. So certainly you can do that. What we encourage young people to do is get all the training and education you need, because this epidemic is going to last a while. Go on to graduate school, get the medical degree, the nursing degree, because that's going to be important. But also be in contact with programs like Hope Worldwide and the programs Duke has, to be in contact with what's going on around the world, visit some of these sites, be aware of what's going on in Moshi and in Tanzania and places like that, so that when the opportunity comes, those two can come together so that you can be involved in programs personally. So we encourage volunteer work coming out for a few weeks or a few months. We can serve people making long-term decisions about coming out for a year. But we certainly want you to get your education, your training, so you can magnify that education on a large scale and have a significant impact.